cell anemia impacts all four of us in different ways. And so that's why we were here to share our personal journey with you all about sickle cell anemia, how you can help, and maybe some signs to look for if you have a friend or a partner that has sickle cell, certain things just to be able to look out for, certain triggers. I want to thank this esteemed panel for being here with me. John, you know how much I love you and appreciate you. John is definitely a sickle cell warrior. He's someone that I look up to personally and wants to learn more about his journey. And then Dr. Bender, I met Dr. Bender when my baby turned 2 months. I appreciate you so much, Dr. Bender. And like over the last almost 10 years, our relationship has grown tremendously. I can call Dr. Bender whenever and he responds. And he retired now from Children's Hospital mainstream with his main work, but I can still reach out to him. Sickle cell makes you become a family. And Ken West, my news buddy, Ken's the man. He's also a Virgo, just saying. And Ken is a warrior that's living with sickle cell too. It was very important to us, the Katie Hall Foundation, that we brought multiple generations to the table. My 9-year-old daughter is supposed to be here too, but you know, very much as sickle cell goes, she's having soreness in her legs today. So she's not at school, she's not here with us, she's at home. But you wanna know what she's doing? This is what I love about my daughter and what I love about the sickle cell community, is she's at home right now learning Korean because she does Taekwondo. And she said, Mom, you're not gonna take me out of Taekwondo, I'm gonna learn how to speak in Korean so I can talk to my teacher and tell him what I need. So when you talk about resiliency, I haven't met a group of individuals that has been more resilient than people living with sickle cell. I'm gonna pass it over to John, and if we can all just give an introduction of who we are, why we are here, and then pass it over to the other person.
Absolutely. Hello everyone, my name is John Musambe. I was born with sickle cell disease. Originally I'm from Uganda, but I was raised here in Seattle. I have a strong passion for sickle cell because I was born with it, but I'm happy to say I'm on the other side of it, where I did have a bone marrow transplant. So I am here to offer direct patient experiences with sickle cell disease, living with sickle cell, and also hopefully serve as a resource to some of you here. Thanks for being here.
My name's Bender. I'm a pediatric hematologist and also a basic researcher, basic science researcher. And I started my graduate school research on sickle cell related gene therapy and how the sickle gene gets turned on and off. And then I went to Odessa Brown early on in my career to visit the sickle cell clinic and just fell in love with the population and really realized as I dug deeper about sickle cell is one of those diseases that epitomizes all of medicine. It brings in every aspect of public health, racism, genetics, molecular treatments, pharmaceuticals, community support. There's just so much to it. And the group of people impacted by it, I mean, I'm honored to be part of family, but I'm just overwhelmed and honored to have a chance to work with this community.
My name is Ken West. I am have sickle cell. I am close to my 65th birthday.
Yeah.
Go Virgos! I'm also president of the Metropolitan Seattle Sickle Cell Task Force, and I am here to raise awareness and about sickle cell, talk about education and advocacy around sickle cell as well.
Thank you all so much for being here. And Ken, I just want to thank you because on Sunday, you gave me perspective. It was a little cold outside. We were out at 6 o'clock in the morning, maybe 6:40. Well, you were there at 6:45. I got there at 7:10 at King 5. And what I appreciate about Ken is I was able to be around him without my daughter being there, so I didn't have to be on. I was able just to be a student. And when Ken was like, hey, no, I'm sore right now, it just made me feel a little bit better that every September is not just my baby, being sore. So I want to thank you for that. Whoever can start, how has, and I don't like using the word sickle cell disease, so you have to just bear with me. How has sickle cell anemia shaped your perspective on healthcare and community support?
Having born with the illness, having learned to navigate through the system at an early age, sickle cell has always taught me to learn to be resilient, to learn to be aware of not just my own self, but to be my own self advocate in the healthcare system, right? Because when you have the illness, such as sickle cell, it's not tangible. Most of the symptoms are not just physical. When someone tells you that they're hurting or they're going through an episode of pain, it's not something you're always going to see visually, right? But you can see that they're frustrated. There's agony. There's pain. So having that at an early age, you have to learn to be a self-advocate when you're interacting with your doctors at the hospital, to let them know this is how you're feeling. And then on top of that too, it could be lonely when you have illness such as sickle cell, right? Because it is considered to be a disability. So sometimes navigating that at an early age, not just in school, where you're unable to go to school because you have pain or you're down for a couple of days, right? And then spending more time in the hospital could be 3 or 4 days, sometimes up to a week. So there's this part of life that you're missing out on. All of that could get overwhelming and cause a lot of anxiety, stress, and depression. However, this is where the big part of the community comes in. Being part of the community and in healthcare, they go hand in hand. Meaning, I am part of the Seattle Sickle Cell Task Force. And that task force, those Ken just mentioned, that task force has created a sense of community whereby you have people who are going through shared experiences just as you. Right? So you're not feeling like you're the only one in the world who's going through it. And then, so community is really, really big part because it allows you to have some level of comfort, a support system, and then also understanding resources that you may not know even existed. Such as, like, you could, if you are short of food, or maybe you need how to talk to your doctor, reach out to your doctor a certain way, or going through some social issue. Community is there to support you. And the last part of that I'm going to tap into is another part of the community is being part of your healthcare community, interacting with your doctors, interacting with your care team. All those, sickle cell has shaped me to understand, like, although I might go through these difficulties, these are the kind of people and issues that can support me in that area. Hopefully that can answer the question. And I'll pass this on to Ben to maybe see if he can offer his perspective.
Definitely.
And for me, clearly, John and Ken, their perspective is really the most important one here. So I'm going to really limit it. You know, from the medical side, there's conditions like a simple urinary tract infection or a simple strep throat, where you get diagnosed, you take a medicine, it goes away, you're done, it's not a big deal. But when you have something, as John was talking to, that sort of hits all aspects of life, in the clinic, in the hospital, home, school, is always there, and where there's so many barriers and obstacles to overcome, it's not like a urinary tract infection. You can't just take an antibiotic. You need more. You need more support. You need more understanding. You need more resources. And yes, the medical system provides some, but that's not their main focus. It really needs to be community, people with shared interests, you know, as we brought up, family, to really be there and support. And that has to be a rich and important part of all this support as well. And then you add to it that I think everyone's aware that the healthcare system has many problems, especially with chronic disease, especially with pain and chronic pain, especially if you're not Caucasian. And to be in a situation where you've got a chronic disease and pain, and then also have to deal with those other issues, it's too much. And so you need to rally and have as much support as possible from wherever it is, whether it's family, school, community groups, religious groups, the more the better.
My experience with sickle cell and the medical community has been long, 65 years worth. And when I was younger, and meaning that I was in grade school and stuff like that, I did not know very much about sickle cell, nor did my family. So it was a process of education. Education which leads to advocacy. Now, because I lived in Seattle my entire life, there's a small group of us in Seattle, ever-growing sickle cell community, but we, as John and Bender have alluded to, learn from each other, because this is what we have to do to get the resources that we need. We rely on each other for education, we rely on each other for advocacy, and it was really good to meet others with sickle cell. So that community binds us together and makes things much better, because sometimes you feel, like John was saying, that you're alone, that you are the only one that has sickle cell. You are, tend to be a little, a little separate from everyone else, because there are a lot of things that go with this. One, how do you explain to people that you have sickle cell? You look okay. John looks good, yeah, and I don't look too bad for someone 65, but
You look good.
but still, outwardly, no, doesn't look like you have anything going on. But inwardly, there is a lot of things that are going on. And to be able to explain that and be able to convey that, not only to someone in your community or a friend or someone like that, but also to the medical community, can be challenging. So that's kind of the tip of the iceberg for me.
Yeah, absolutely. We're gonna go a little bit deeper.
And can I add
Yeah,
a comment to that?
absolutely.
And it puts patients in a really tough situation, right? Because, and everyone's different. I don't have sickle cell. I don't want to speak for any one person, but many people don't want to go through life complaining. If they're hurting, walking crooked, walking slow. The whole thing is to try to fit in, to try to look normal, to not always carry that pain outwardly or show it outwardly, which is tough because then the system sees you and says, oh, it can't be that bad.
Yeah.
Look, he walked on in, he's not crying, he's not curled up, he's exaggerating. But pain is subjective, right? It's inside you. There's no test. The only way to really figure out how much there is to ask. And so if the system doesn't always trust that, and you look good, it's easy for people to say, it can't be that bad.
Yeah.
And going along that message, we tend to be, people with sickle cell tend to be a little stoic.
Yeah.
So, part of our head is thinking about the pain and that kind of stuff, but the rest of us, the outward part of us, is like, you know what, we got to keep it, there's nothing going on here. And then you go to the ER or somewhere else and you say you're in terrible pain, and they go, well, to Bender's point, it's like, well, we don't really see that. And so you get into that area where it's like, oh, well, should I be acting out? Should I be, writhing on the floor and stuff like that? It's like, if I'm in pain, you need to believe me.
Right.
I have been dealing with this my entire life.
Right.
I know what is going on with me. You need to ask me questions that are appropriate. I will give you appropriate answers, and then we will go forward. But that is the utopian idea of how things should work. The real, realistically, that is not how it works.
Yeah.
That there are lots of challenges in communicating with the medical community about how you are feeling. What are the next steps? You know, what do you need to feel better? We educate our people with sickle cell that this is what you need. You find out what you need, you memorize that, you convey that in a intelligent way, and you should get a positive outcome.
Absolutely. I'm happy that you went into medical and like the experience in the ER room and at the hospitals. I'll share a quick little story, and I want to hear from both of you on some of the daily challenges and in the hospital. In 2023, I believe, at this point, these years go by so fast. I knew my daughter had asthma since she was 3 years old. I kept telling our doctors, and this is not you, Dr. Bender, by the way. I know you was her doctor back then.
I remember.
But it wasn't you, I promise. But I kept telling her doctors, like, she has asthma. And they kept telling me, no, she does not have asthma. It's called acute chest. I'm like, listen, I grew up with asthmatics in my house. I know what asthma sounds like. That is asthma. It took 4.5 years to get the diagnosis of asthma. And once we finally got the diagnosis of asthma, we're in the hospital. And there was a doctor at Children's at night, so maybe he was the night shift doctor for whoever comes to ER. And he came into the room, and right in front of my daughter, both of them, he said, "What's wrong with you from just getting her in the hospital? She could have died, for crying out loud." And he said it right in front of her. And I remember, I'm from Detroit, so I straight went Detroit. We dropped all of the degrees and everything. And I said, "Who do you think you're talking to? You don't talk like that about my daughter in front of her while she's sitting there." And to know KJ she's life. She's the life of the party. When I say her whole entire face sunk in and went down, and she was like, "I could die? Huh? What do you mean I'm about to die?" And it was asthma. It's something that I kept saying. It's even documented that I thought she had asthma, but it took for her to have this bacteria infection and to be down. And sometimes with the bacteria infections, you can go from being 10 and all the way on to dropping very quickly. And that's exactly what happened with us. I'm always on the phone, I'm calling. And when we got in the hospital, I remember I took it to the next level because he really pissed me off as a mother to say that in front of my kids. And so I reached out to the CEO of the hospital. I'm a communicator. I reached out to everybody, wrote letters. And then the doctor did send her back a letter and apologized to her. But even in the apology, there was systemic racism even in the apology. And I kept that apology letter. And I got it for KJ so that she can look at it as motivation, so that when she becomes a surgeon, she don't treat people that way. And so I guess Ken and John, what I want to know is if you could share some of the daily challenges of living with sickle cell anemia. And I know you don't have sickle cell anemia anymore, but how has it impacted different aspects of your life, such as work, relationships, mental health, and how do you deal with medical staff when they do things like that?
So,
And she was 7, by the way.
yes. You see, the thing about having sickle cell, I think I'm going to piggyback off of that, but I want to take the opportunity. I always ask providers how familiar they are with the illness, right? And I see some of you in here, you're not providers yet, some of you, I'm not sure, maybe some of you will be. So looking around, how many of you are aware of sickle cell disease? Or have you heard of the term? You have, okay. And do you know where prevalent it is, in which population it is most prevalent in?
I don't know the exact numbers, but I know it's most prevalent in African Americans.
Yes, good. So I say some of you are African Americans in this room, right? Sickle cell is prevalent in our population, right? In our population. So knowing very well, bringing you back that in, I wish at an early age I knew that my race would impact how my patient experience will be growing up, right? I felt some experiences, but I didn't catch those early on. And I'm talking about biases, right? I'm talking about where you would think that, oh, just because, my pain scale as a Black patient might be completely different versus the normal pain scale for a normal white patient. There is a pain scale that patients have to go through. And at an early age, I had to learn, not just me, but my sisters as well, and my mom as well. We had to learn how to call out, use every opportunity to talk to the doctor and let them, hey, I understand this is what the protocol says. I understand this is what you're supposed to go by. But sickle cell pain is completely different. And I know my race impacts how you might treat me. So whatever experience you might have felt like outside of this, please treat me individually with respect, right? That was one thing. And then the other part of that is I had to continue to do that, not just in the hospital, but at school, right? Because there are moments where at school you have to miss class, miss exams. We did not know at the time that, you know what, it would just be unfair where you miss an exam because yesterday I could be chilling with the homies, we're relaxing, right? And then an hour later, 2 hours later, I hit them like, yo, I gotta go to the emergency room.
Right.
And then next day, maybe I have a class or the exam, and I miss that, and that will impact my grade. And then I had to show up to my academic counselor and tell them, hey, I missed because of this. But what really helped at the time was that, yes, I did have my doctors at the time write a note to show that, yes, I was in the hospital. But sometimes that was still not enough, right? So it would take a lot of self-advocacy, but every opportunity I interact with the doctor or teacher, I use it as an opportunity to educate. So I'm asking most of you in here, so you will interact with some people at some point, right? Especially in talking about you African Americans in here as well. When you get to, even if you're in your community somewhere, look out, take your ask in your family, has anybody, you guys know if anybody has had a sickle cell trait?
Yes.
Right? Because you never know, right? And if not, how can they get screened, right? So these are so many pieces I've put it together, but I'm telling you, as a patient, I had to advocate for myself in the hospital. As a student, I had to advocate for myself in school to know that, hey, I need to be to be registered at the disability office at school so that my grades do not get impacted. Now I'm on the other side. I'm in the workforce now, right? I'm in healthcare. I also I had to use that as an experience that inspired me to actually pursue a career in healthcare, whereby I help patients navigate through the healthcare system, giving them resources, working with patient and providers and community so that they know where to go, right? And so they don't have to do the same experiences I went through. Long-winded answer is, even in the workplace, we always have to let them know, like, hey, sometimes I may not be able to show up to work because I'm not feeling good. And that shouldn't have to be a barrier to impact your work so that your ability to provide to your family, right? So knowing what your rights are, right? And also using it as an opportunity to always self-advocate and educate and figure out where my resources are has been key.
Absolutely. Thank you so much, John. And you're right. I mean, because in the schools, that's like, I find that the schools are where a lot of things happen at. And if we don't catch it early enough, the hours add up, the pain adds up, and it takes that many more hours to get out of it. So thank you so much for that.
Can I add something to what John was saying?
Sure.
So John brought up a critical point in terms of knowing your status, in terms of if you have sickle cell trait or not, right? As he brought up before, it's genetic, right? You can only get it if both parents have something related to sickle cell or something related. Every child born in the United States is tested for sickle cell at birth, okay? So a lot of that information is somewhere. If you were born in Washington State, they report out if you have sickle cell trait. But that doesn't always make it to patients and families. Sometimes doctors don't pass it on. Sometimes you're a family with a new baby, and on top of everything else, they go and bring up this thing. It's like, I'm too busy. I'm not sleeping. There's too much going on. It just, doesn't enter your head. If you were born in Washington State, you can have your provider reach out to the state and find out if you were tested and what the result was, right? And I encourage it. And if by chance you do have trait, it's not simple, okay? John's right. In the United States, most people with sickle cell disease and trait are of African descent, but it can be in any racial, ethnic background. There are Caucasians. It's common in Hispanics. And there's a lot of that, and on top of that, so you can't just make an assumption in terms of who your partner is. And then on top of it, there's a lot of bad counseling, and part is it's complicated because there's other related things to sickle cell. And so one parent might not have sickle cell trait, but they could still have a child with sickle cell.
That was me. So I didn't know until I was 32.
Yeah.
That was me.
Yeah. And so it's not as simple. And so it's about finding out and going to a qualified person for information. And if you've got trait, that doesn't mean, if both partners have trait, doesn't mean you shouldn't have kids. But you should at least have the opportunity to learn about it if you're interested in it.
Absolutely, and it can from there, and I appreciate that too, because truly, I mean, my husband was my high school sweetheart. We always knew he had an S trait. I never knew about the C until we had KJ and we got the call. We got that call when she was 5 days old. I'm like, what are you talking about? They're like, no, it's not true. And they said, we'll bring her back in, we'll do it again, and did it again, and it was true. So I agree with you so much. And what I would say, I'm not from here, I'm from Detroit. They didn't check me in 1982 if I had the C trait. They did not. So I would also recommend that you go and just get yourself screened if you don't know. We met so many young people last year at the, the Mental Health Summit with the Washington Therapy Foundation. And they're like, I think I got sickle cell. I heard my grandma said somebody, they didn't know. And so sometimes you may have different pains or symptoms happening and you don't even know that you have the trait. And if you did know, you could be doing certain things. So I just wanted to push on that. We do need to get tested if we don't know. And Ken, if you could please bring that home on like the mental health, the relationships, and what have been the most effective ways for you to manage these challenges? I heard John say advocating. Advocating. What have you done?
Well, I'm glad that we're talking about the mental health aspect, because that's what a lot of people don't want to talk about. They don't want to talk about the mental health aspect because there is a lot of things that go into it. Number one is loneliness, being separate, being different. Everyone wants to be, part of a group, a clique, a squad, whatever the new term is these days. And when you are different, it takes a mental toll, and especially when you're a young adult, right? When I was in my 20s, I wanted to be just like everyone else. I was out with my friends, we'd go kick it, have a few drinks, have some fun, and then the next day, I would have a sickle cell crisis. And I would, at that time, hide from them. I would check myself in, go to the hospital, be in the hospital for a week, and not tell anyone, because I did not want anyone to know. I wanted to hide. And that created a huge toll on me because I felt alone. But what happened was that they all knew, and one day they just showed up in my hospital room and they said, hey, Ken, you're not fooling anyone. We know what's going on with you. Just let us know. And that sense of community was a mental relief for me. And that's really what we really need, is to make sure that we are talking about sickle cell, not only the physical, but the mental part of sickle cell, because there's the anguish of having a chronic disease. There's also the stoicism, right? You tend to be standoffish. People think that you're aloof because you are not talking about it. You're not wearing your heart on your sleeve, so to speak. But, let's face it, some of us are very private people.
Yeah.
And because of that, it's like, well, I'm not going to tell everyone that I have sickle cell and that kind of thing. So the mental aspect of it is huge, and we need to continue to raise that and address that.
Absolutely. So this question can be for any of you. It was for Dr. Bender and John. Sickle cell disease disproportionately affects communities of color. How important is cultural understanding? And this is for you too, Ken. How important is it for cultural understanding when it comes to treating SCD, sickle cell disease? And how do cultural beliefs influence care?
I love this question.
Yeah, so do I.
So take it up.
So one of the things we used to do at the sickle cell walk that we just had last Saturday, the 19th annual. Anyway, there's a little plug there. Is that we have these dolls, and there are 5 of them. And the question is, which one of these dolls, and they're all different colors, which one of these dolls has sickle cell? And everyone would get it wrong, because all of them, in different ethnicities, could have sickle cell. And it was kind of a trick question, but it also was thought-provoking and dispelling of myths that people have about sickle cell, that it only affects black people.
Yeah.
But there are, like we mentioned earlier, Hispanics and others that are also affected by sickle cell, but some may not know it. So the challenge is to raise that awareness. So to Bender's point, people need to get tested, no matter what ethnicities, to make sure that you don't have the trait, for example.
I guess just to make sure I understand better how it has to do with black, people of color, black people mainly, right?
Yes.
Okay. And it's in several areas. One, I would say every institution has racial biases, right? Since sickle cell is predominantly a black illness, predominantly black African Americans, I think it's really, my direct patient experience as a black patient has been completely different, as I would say, for other white patients, especially when you're in the emergency room, especially when you're in a hospital bed, right? Sometimes the interaction hasn't been the most compassionate, right? When you're in healthcare and you're hurting, and let's say you're having a crisis. If I don't know what a crisis is, it's an episode when your body is hurting due to anytime there's an area of your body that's hurting, that is considered a sickle cell crisis. So you go get treatment to the hospital, right? Sometimes it could be an infection causing it, sometimes it could be anxiety, it could be stress, it could be all these other factors. But sometimes how I could show up in that moment, I could show up either super anxious or upset, but that could be perceived as like I'm being rude, right? That could be perceived as, oh, I'm being non-compliant, right? But in reality, I'm already carrying all these burdens from outside where like I probably miss school, I probably can't have with anybody, I probably have deadlines that I'm supposed to meet, and I'm already anxious with just life as itself, right? Hurting me. So then on top of that, I have issues, probably like issues at home, and then I'm showing up with this pain episode, right?
And then people ask you stupid questions like, how long have you had sickle cell?
Yeah, how long have you had, right? So cultural sensitivity is really important in the hospital setting, where we need to talk to our doctors, like to be culturally sensitive when they're interacting with not just black patients, but not just sickle cell patients, but all patients, right? So compassionate is one thing. How I express myself in a press as a black patient sometimes could be different how I express myself as a white or Caucasian or Latin patient, right? That's one thing. And then the other part of that is how it has been, disproportionately is the treatment. We're talking about like funding to therapies, right? Sickle cell and cancer, they're both black illnesses, but cancer illness, of course, is a much bigger population. They're going to get more funding to get more cure, to try more clinical trials and curative therapies, right? That is something that has not really fully happened in the sickle cell community, mainly because, they say it's not a lot of us, and on top of that too, it's a black illness, right? So that's one thing. So now we're at a space where that really set us back to the point where there was not a funding for bone marrow transplants, for therapies that could have been, to help manage the care. That set us back a long time ago, right? But now we're at a place where every institute wants to be inclusive. And this is our opportunity to seize that.
Seize the moment.
Seize the moment, right? doctors, hospitals are taking the moment to say, you know what, now we're going to put more funding on sickle cell. What I want to put a spotlight on this around and Seattle Children's. What they have done is they listened to what the community was saying, and they put together a team and also funding to be able to meet the resources and needs for people with sickle cell disease in their community, right? So they show up at community events. They do collaboration with Fred Hutch and University of Washington to be able to discuss curative therapies such as bone marrow transplants,
Yeah.
gene therapy, right? And all the other things Bender probably could speak to.
Yeah, we're going
Right
there
now.
next. Yeah.
But I think those are the kind of areas like before, interaction wasn't always the best.
Yeah.
And we did a lot of culture sensitivity, cultural inclusivity, right? So that patients don't have to put their personalities down because of this. And then funding to the curative therapies that we're talking about. Now that has happened, we are moving at a much faster pace, which is really exciting. It's not what we want to be, but we're there. And I'm a result of that.
I want you to talk about that before, and I think because of the sake of time, we got about 15 minutes left. So I'm gonna, no, this is good. This is good. What I'm gonna do is I want you to talk about the bone marrow.
Sure.
If that's okay.
Yeah.
The bone marrow transplant that you received, when was it?
Yeah.
How was it going into that?
Yeah.
How are you now? And what if, let's just say if KJ decided she wanted bone marrow transplant and she had a match, what is the 10-year window afterwards? So if you could talk to us.
Yeah, absolutely. So prior to my bone marrow transplant, my transplant was done in 2012. Right? We're looking at 12 years ago now.
Oh, wow.
Time does fly. But prior to that, to get to that point was the biggest struggle because I was sick to the point where I couldn't walk more than 2 blocks without oxygen. I had acute chest syndrome. I was getting exchange blood transfusions, meaning they'll take your sick blood out and put new blood in, right? So it's really great that all of you guys are here because if it wasn't for people who are donating blood, I probably wouldn't be here, right? So you guys are doing a really, really, really great job. You're helping not just me, but other patients too, right? That you probably will never meet, but this is a great thing that we're doing now. But bringing back to the transplant situation, the transplant by itself, I did what they call bone marrow transplant with a related donor. My sister was my donor. What they had to do was to see if my sister would match me to make sure that my body would not be able to reject her cells. Whereby they'll treat you like they treat cancer, to give you radiation, chemotherapy, pour all the sickle cell out, and then put in my sister's cells so that my body could learn how to rebuild, right? To fight, not to learn to be normal again. What I can say, that process for me, the first 6 months were excruciating because it was side effect after side effect, right? But on top of that too, there was the isolation. You're in those rooms because your immune system is down, right? But your body's just relearning to be itself, to build again. There's just new donor cells that they're giving you. However, what I do want to thank the team at the hospital, Fred Hutch and Sarah Jill, what they did for me at the time, is that they gave us the option. They came into them, they're like, hey, you're pretty sick. We're not so sure, but this is what is available. The bone marrow transplant is available. Do you have a sister? Like, yeah, I have 3 older sisters. Cool. This is, let's see if any of them could be a match. These are the potential risks, right? Potential risks like your body could reject it, but then the other part was like, if everything goes well, because we've done this before, your body could overcome this and you no longer have to suffer the consequences of sickle cell disease. So that was a tough decision, but already it was really hard because I was already sick at the time. So I was like, talk to my family, community partners were like, you know what? I think there's nothing else to lose over here. Fast forward. Happy to say that the bone marrow transplant was successful. It took me about a year, almost 2, to fully recover. Because the first 6 months were in the hospital, and there's going to be a lot of clinical, going back and forth to the doctors. However, that was the start of my life all over again. At the time, I didn't even have ambitions to go to school or go to college, but once I got my bone marrow transplant, I felt pretty new, right? And even life post-transplant could be hard. It takes a mental toll on you, but also it gives you, I was looking forward to the good part, right? The hope. that will come of it. So right now, I went back to school. I got my degree in public health. You know, I'm in health management. I'm running programs, and I'm also educating people about sickle cell disease. So for every parent out there, if you have a child with sickle cell and another child with no sickle cell, ask your doctor, like, hey, what are the potential opportunities to cure my kid, right? And can you give me more information about a bone marrow transplant? Not just the benefits, but the risks. And then also the cost as well, right? That's also another thing for the parents too. So just to kind of touch on, that is something I think, as the doctors give you those opportunities, get informed, and then with the decision, you can make the decision with what to proceed or not to proceed. But I can tell you right now, I am here because of that.
Wow. Wow. I think you're the first person I met with sickle cell who's been through the bone marrow transplant. So thank you so much for being here. And thank you for always being so generous with sharing your story. Because like Ken said, everybody, may not want everybody to know, what I'm saying, all your business and things like that. But I do appreciate you being generous, both of you, with your stories, and Dr. Bender with your years of experience as well. We touched on bone marrow. We know CRISPR, if you don't know, CRISPR is out there live now. And there's so many others. Dr. Bender, there have been significant advancements in research and treatment for sickle cell just in my daughter's 9 years, just in the time I've known you. I remember where it's just like kind of like this, at least I was, like, oh, we need this CRISPR gene therapy. Can you explain some of these innovations and what they mean for the future of sickle cell anemia treatment?
Sure. And let me be clear, there is so much importance of supporting people with sickle cell, and the vast richness is not the medicines, it's the community support, it's the education, the other things. So right now I'm just going to address some of the medical things. So going from first, you're bringing up CRISPR. There's multiple types of gene therapy, some involving CRISPR, some not. They each have advantages, disadvantages. Currently, we're not calling them curative because they're new and there's relatively little experience. And just there's some huge advantages over transplant. There's some things that may be more worrisome. We're sorting all that out. So as John brought up, find out about the pros and cons, the good and bad of all of them, okay? So there's the gene therapy, which is nice because you don't need a different donor. You're the donor, okay? So you don't have to worry. John was talking about the immune systems and things taking. You don't have to worry about that with gene therapy. With bone marrow transplants, there's lots of different kinds. It can be with a brother or sister, or it could be a parent, or it could be someone completely unrelated. Again, each of them have different ways of doing it and different pros and cons. Even though sickle cell lags behind other diseases in terms of not having as many people focused on treatments, it is improving a lot. And I think one of the big problems in the past is people focused on hemoglobin. In sickle cell mutation, the problem is in hemoglobin, and everyone focused just on hemoglobin and treatments that would affect hemoglobin. But the more we learn, we know the white blood cells are involved, blood clotting's involved. There's a whole bunch of different things involved. And so when you know that, now you can come up with different medicines. Some that lower the white blood cells that helps. Some make white blood cells less sticky. Some make the hemoglobin change so they don't form the crystals that cause the sickling as much. So there's more and more different medicines that don't just hit the hemoglobin, but can do multiple things. In oncology and cancer, if you look at success of kids diagnosed with leukemia over the years, it keeps getting better and better and better. Why? In part because you go from one drug to multiple drugs that each hit a different pathway and a different system. So the idea is, I don't think we'll ever have one miracle drug, but you might have one that helps, the white blood cells, one that helps the platelets, multiple ones all interacting, and together it ends up being really powerful.
Thank you. And I want to thank all of you too for sitting here. I mean, Y'all are in high school, y'all don't have school today, y'all still in here learning. We appreciate you all so much. Sincerely, and for the ones who are watching online, we appreciate you too, for whoever's tuning in. I'm gonna ask a question to kind of close it out. I'm gonna start with you, Ken. When we think about resilience and support in the sickle cell family, I think that we were laughing because I was telling you on Sunday, I was like, man, my daughter, sometimes she goes around teasing people like, yeah, you don't got that sickle cell. I got sickle cell. I can survive malaria. And I'm like, Ken, I was like, I need your help, man. We got to kind of balance her out a little bit because she's going around teasing people for not having sickle cell. With that being said, what role does community support play in the lives of those affected by sickle cell anemia? And how can communities better support? You're the president of the Metropolitan Sickle Cell Task Force, which will be 20 years old next year. And I'm sure you've probably been there all the years.
Yeah.
So can you please talk to our community that's here? What can we do as community members? If sickle cell doesn't impact them, what can they do and why are they important to our fight?
Well, thanks for that question. The important part is education, learning more about sickle cell. There is book learning, and then there's people coming up to people that actually have sickle cell and talking to them about what their life has been like, what has been the things that they've encountered, what things have helped them, so that they feel that you are interested and that you get the flavor of what it's like to have sickle cell as well. Two is advocacy. Help us advocate for ourselves and for others with sickle cell. Three, give blood. This is what people are here for today. Find out more about giving blood, and of course, being part of the sickle cell community. We do not want to be alone. We want to be inclusive. We need you to be inclusive so that people more understand what we go through. We want people to be part of our community because it takes a village.
Yeah.
And you can see by the people that are here, all sorts, walks of life, all disciplines, all different kinds of people. It takes all of us to move forward awareness and education about sickle cell disease.
Thank you so much, Ken. Before we close out, any call to actions? Ken, you want to kick us off with a call to action? Maybe we can all give a call to action.
Absolutely. Do more of these. Do more blood drives. As people may or may not know, a lot of us with sickle cell need to have blood transfusions, and a lot of the time it's monthly. So that requires a lot of blood donation, and it's better if it comes from people that look like us, look like you. That's what we really need.
Get involved, community groups, friends, society, donate blood, donate money, volunteer time, get out, vote, get involved. Don't be passive.
And I'm going to piggyback over that because most of you guys are probably still in high school. I would say ask questions to your teachers, right? Ask them like, hey, how come we never had a session about sickle cell disease? Or, challenge them like, hey, can we have a topic today in maybe science class or whatever about sickle cell disease, right? And see what they can come up with, okay? That would be one thing. Another thing, go on your social media. Just go TikTok, Facebook, Instagram, whatever. Just type in sickle cell 101 or what it is about sickle cell disease. Just be curious, right? As much as you're curious about the next trending song is, be curious. Be curious about sickle cell disease too, because you never know. It could be not be you, maybe a family member or cousin or someone in your family that could probably have it, and you just don't know it, right? And then that way you probably be, and then another part would that be a support system, right? Find people you can connect with. Here, the Kitty Hole Foundation can do that. the Metropolitan Seattle Sickle Cell Foundation can do that. We have a Facebook page. You can find this. We're on there. And then also, this is Brown Children's Clinic.
Yes.
They're very
That's how we all
strong.
met.
Yeah, that's how we all met over here. So it's a really, really good way to be involved and be active participants. Show up at events. Sometimes we do online sessions. We just do game nights. Just come and join us. We're cool people. You can hang out with us. And yeah, I think that should be
Yeah,
it.
you know, John, you're my boy. Like, seriously, you all are. You all my guys. You know, I guess the one call to action is we want more men to do panels. I know this is my first time having a panel of all men ever.
Hey.
And I've been doing this since I've been like 14 whole panels. I never had a panel of all men. So thank you all for coming in and speaking. The second call to action I would say is if we share something with you, hey, my daughter has sickle cell, or whatever the situation may be for your families. The one thing that always disappoints me is somebody like, oh, I'm sorry. What are you sorry for? like we don't want to hear that. You know, you gotta say you're sorry. We're good. We're resilient. We need help with the advocacy part of it, but the sorry, keep it, because we're not sorry. And people do that to me a lot. They go, oh, the little one don't get it. Oh, thank God. Like, we don't need that. You know what I mean? Because at night, that's going on in the back of my mind 500 times over. What is it doing to the kids? That's number two. I would say number three is give blood. It could truly change lives. It could save lives, should I say. So give blood and, you know, join us. And if it wasn't for the work of the Metropolitan Sickle Cell Task Force, what they've been doing for 20 years, Katie Hall Foundation, this part of our work probably wouldn't even exist. Because one thing that we don't know, you see us sitting up here, but there's been many nights that us parents are on the phone with each other 2, 3 o'clock in the morning. Uh-oh, it's March 1st. Are your kids having a sickle cell crisis right now? Yep, mine is too. Okay, we're in the tub right now. And that is extremely stressful on the parents. And so sometimes when we don't come to your events or different things like that, we might be exhausted and we might have chronic pain happening in our bodies now because a lot of times we're carrying, you know, our kids. And my daughter's about as big as me now, just being honest. And so we're carrying them. And not only are we carrying them physically, we're carrying that pain. And it does go throughout our bodies too. So we want to just thank you all. I want to thank you all for coming, leaving work, and hanging out with us. Sorry I don't have any Ezel's chicken this year. And we want to thank all of you for coming out and spending some time with us. Sickle cell anemia, and there's a film out called Super Cell.
Yes, on Netflix.
No, on Netflix, and it's about sickle cell. It's definitely sensationalized and it's cartoonized and all that stuff. But I think it's a very great film to be able to watch. There are superpowers, I believe, for people with sickle cell. But thank you all so much for coming out. Thank you all for being here, and thank you for being online. We appreciate you.
Thank you.
Yeah. Okay, so Tamira, now she moved her booty right there. Can you see? It's sticking out. Oh my God, this baby is something else. Let's see where that ice at. Hey, pretty baby. Hey, girl. Check you out. KJ. Say hi.